You have seen the breast cancer journey from both sides of the bed rail.
She called and said, I have some bad news. You have cancer. This sucks, but you're going to be okay. They can't tell you if it's spread until they do surgery.
What should people know if they're a medical professional about the emotional journey somebody going through breast cancer is going through?
It's one of the biggest journeys they're going to take, and it's a scary journey. But most people wind up okay.
Yeah.
And I think people don't know that.
Shelly, thank you for joining us today.
Sure.
You have seen the breast cancer journey from kind of a little bit, or at least the cancer journey from both sides of the bed rail, right? You've
Yes.
seen patient and provider.
Yes.
So we're going to go through not only your journey, but the things you've learned, the lessons you want to teach other people, things like that. What should somebody know about you before we dive in?
Well, I was an oncology nurse for many years. I'm a mother, a grandmother, a runner. Yeah.
Yeah, well, that's good. I mean, as a nurse, were there any symptoms that you noticed before you were diagnosed with breast cancer that kind of, like as a nurse, with your medical background, that helped you notice something was going on?
No, I did not have one symptom or sign. I found out through a routine mammogram,
Really?
a yearly mammogram. Yeah.
There's nothing exactly that you had in terms of your expertise that people should be worried about, that they don't have an expertise of understanding the medical field or just medicine in general that should help them prepare. They should just get their yearly mammogram.
Get their yearly mammograms. If you get any symptoms, anything like
What is something somebody should look for?
redness, swelling, a lump, itching, anything unusual,
Yeah, that makes sense.
just don't ignore it. And no question is stupid that you can ask a medical person. Ask any question. There isn't a stupid question. Because some people are scared to ask that it'll sound dumb. But no.
When your life's at stake,
Yeah.
ask the question.
Right. Ask a question. Yeah.
Yeah.
Even if it seems silly.
Yeah.
Yeah.
I love that. So can you briefly explain that kind of checkup? Let's just start at the mammogram. Like, what does that feel like? What is that, going through it? I'm sure even, every time you go through it, it's got to be a little bit of a scary experience.
Nobody likes mammograms. You put your breast in a machine and they squish it. I mean, it's not painful. It's just weird.
Mm-hmm.
It doesn't take very long. They take a couple of pictures. That's all it is pictures. And you're done.
Yeah.
And then you get a report either while you're there. Some places do it immediately. Other places send you a report within a week.
Okay. And then
simple.
You get that call.
Yes.
Explain to me kind of how that process works.
You get a call, and I've had a call before because they give you a call saying, we saw something on your mammogram. We're not sure what it is. And they're not. It could be a cyst. It could be a shadow. It could be a fold. It doesn't have to be cancer. And they can't tell from the mammogram if it's cancer or not. They just say, we want to take some more pictures.
Yeah.
But, your heart still sinks,
Yeah, I could imagine.
You make an appointment to go back. You go back, you get an ultrasound and another mammogram.
Mm-hmm.
And they still don't tell you anything then.
Really?
Yeah, because they might tell you right then and there, or you might leave and have them let you know.
Right.
So every place works different.
So they let you know, like for somebody out there.
So while I was at the ultrasound, they did say, well, I think they said, we'll let you know for sure, but we think you're going to need a biopsy. We're not sure what this is. We do see a mass or something.
Mm-hmm. Yeah.
But they said, don't worry about it. It could just be a cyst. I can't remember the exact percentile, but 95% of these wind up being nothing
Really?
to worry about. Yeah, it's pretty high. But I don't quote me on it because I'm not sure the exact number.
No, that's fine.
But so you walk away thinking, well, it doesn't have to be cancer just because I'm getting a biopsy.
A biopsy.
Yeah.
Okay. And then you get that detection, during the detection phase and the diagnosis.
Then you go get a
stage.
biopsy.
Right.
And they don't know. They have to send the biopsy away.
Right.
So you have to wait a few days, and then you get a call.
And that during those few days, what was going through your head?
You're very anxious. You think, do I have cancer? Don't I? I can't be.
Right.
But yeah, you're just on pins and needles waiting.
Yeah.
That's the hard part. The waiting is the hard part.
Yeah. It's got to be one of the worst. Right. And then you get the call that confirms there's something. So from there to the actual
confirmed it was cancer. Yes.
From there to the diagnosis, walk me through what that looks like.
Well, they tell you have, she called and said, I have some bad news. You have cancer. This sucks, but you're going to be okay. It's really tiny. I don't know if they knew exactly what type of cancer it was at that time or not. But you think, okay, that's all the testing that goes on, but it's not. There's more after that. So they can tell you have cancer, but they can't tell you if it's spread until they do surgery. And then you have an option of doing a mastectomy or doing a partial lumpectomy.
Right.
You have an option of getting testing done on your genes to see if it's genetic.
Right.
Because if it's genetic, you're going to want to do a mastectomy. If it's not genetic, you don't have to. It's complicated. It's not cut and dry.
So it's not. Let's take a step back from there, though. It's you've got the news, and you've kind of walked us through a little bit of what it looks like practically. But let's talk about emotionally. Like when you get that first news that you've got something, and we've got to check it out further. It's cancer, but we've got to check it out further.
Right,
How did you feel?
I think you go into like a shock-like state. Because me, no,
right?
You can't believe what you're hearing.
Mm-hmm.
I think that's kind of an outer body kind of experience.
Yeah, and from your background as an oncology nurse, did you have any pieces that helped you with that, or did you feel like it was actually a disadvantage at that moment?
The piece that helped me with it was that it was small. For me, it was like, okay, good, they caught it early.
Mm-hmm.
I had to hang on to the positive. If I could make something positive out of it, it was that it was tiny. So in my head, I thought, okay, maybe it hasn't spread yet, and that's good. They could take it out, and then I'll be okay.
So would that be your advice to somebody that maybe got diagnosed yesterday? They got the call yesterday. That find the positive? Would that be your advice?
If you
find
can,
something.
Yeah, find something.
Even if they
right.
said,
because you really don't know.
Right.
Just because they say you have cancer, it doesn't mean that it's the end. That you can get through this. There's so many different types, so many different ways it can go. So don't think the worst.
Right. What should somebody ask their doctor after being diagnosed? So you get the diagnosis and you've gone through all the tests.
You get
what
the
should somebody
diagnosis.
ask?
What's the next step?
Yeah.
You need to get a surgeon.
Okay.
You need to get an oncologist. And so you speak to the surgeon first, and she goes over a lot of your options.
Yeah.
And then from there, you get an oncologist.
What should people be prepared to decide when they get those conversations?
Whether you want to have a lumpectomy or a mastectomy,
Yeah. A double mastectomy.
Yeah, double
mastectomy.
mastectomy.
Like that. Yeah.
Or if you have to get the mastectomy, they guide you, but it's your decision ultimately.
Right.
And at that point, you don't know if you need radiation or chemo. You won't know that till after the surgery.
Okay.
So you don't learn everything right away. It's steps.
It's in stages.
It's in
So
stages.
during that stage where you're kind of given those options, how do you make that decision? I mean, you talked about based on potentially, your history and your medical background, or not your medical background, your family background, but what else is there involved in that decision?
What stage is, how big it is,
Yeah.
And you won't find out if it's spread until you have surgery.
Right.
Typically. At least for me, it was really tiny. So they didn't know whether it was in my lymph nodes until they examined them during surgery.
Mm-hmm. So what was your experience exactly, and how did you make your decision on your treatment?
So mine was small. They didn't think it had spread, but they didn't know for sure until they do surgery. So I did not come back positive for it being genetic. I chose to do the lumpectomy. It was the least surgery, with the
invasive.
least invasive surgery there is, and see what happens from there. You can't go further until you have all the info.
What led you to that decision, though, specifically just to get the least invasive surgery?
Well, as a nurse, I know surgery is, you have to recover from surgery. The bigger the surgery, the longer the recovery. If you have mastectomy, double mastectomy, then you don't have to, but a lot of people choose to have reconstruction afterwards.
Mm-hmm.
That's a whole other surgery, a lot more, recuperating.
Yeah.
Surgery is dangerous for anybody.
Bottom line.
Yeah, bottom line. So
During your kind of diagnosis and then the decision on treatment phase, how much of it was confusing to you? I mean, I know you have a medical background, but how much of it was, people talk about breast cancer having so many different lingos and things like that.
It is very confusing. You have to find out if you're hormone receptor positive. That means estrogen and progesterone will make your tumor grow. Or if you're negative, where that doesn't affect your tumor. Mine was positive, which that is actually a good thing because they can give you pills to take every day that block the hormones, so it keeps the cancer from growing. There's that. There's the stage. There's the type. There's there's also different kinds. There's the oncotype, which lets you know whether you need chemo or not. There's a lot of different things they look at that even still I don't understand as a nurse. So I can't imagine not having a background, how confusing it would be.
How would you recommend managing that confusion to somebody going through it right now?
I would speak to people that have gone through it for sure. I would talk to your doctor about it. And if they have someone that like a support system through the physician or hospital, I would definitely talk to them. The more you know, the better. I don't know that I do too much internet surfing because that can be dangerous.
Yeah.
In a way, you get a lot of information you don't understand or a lot of negative, bad stories, and that could be really scary. And it may not be the case.
Right. You go down that spiral and
you could go down a spiral if you look too much.
Right. And how many people were kind of involved in your decision on the treatment phase? Like in terms of, you talked about your oncologist and your surgeon. Was there any other specialists that you talked to specifically or you'd recommend talking to?
No, the oncologist and the surgeon. Yeah.
Keep it simple.
And my family. Yeah.
Yeah.
Simple.
That makes sense.
A lot of people like to give you advice and they're well-meaning, but until they're in your shoes, they don't really know how you feel.
Right.
And all the information you know. So I would stick with the experts.
Yeah. And in terms of the experts, did you seek any second opinions? Did you look elsewhere or?
I did not know. I knew the people. I had worked with my surgeon before, so I knew she was great. I trusted everything she said. And the oncologists, I hadn't worked with them before, but I knew their credentials. I had a lot of people recommending them, and I trusted them.
What would you say to somebody that's unsure with their treatment plan?
Get a second opinion, for sure.
Yeah. Just keep searching.
If you
don't feel
asking
comfortable.
questions, if you don't feel comfortable, get a second opinion.
How did you prepare? So you've got that plan. How did you prepare mentally for those treatments, if you did?
I prepared. I looked at that it was really small, so this is going to be okay. That's how I thought. I thought, okay, you have cancer. That's awful. You found out a really bad thing, but I had the best of a bad thing because it was small and there was treatment, and statistically I was going to be fine. So I hung
Yeah.
on to that. You've got the best of a bad thing. You could do this. I was lucky.
Yeah. Yeah. So find the positive.
I found the positive. Yeah.
yeah.
I was the lucky
Whatever
one.
it might
It could have
be.
been so much worse.
Right. How about practically? Is there anything you can do to get ready for the treatment that
I mean, just try and
body-wise?
stay as healthy as you can. Eat good, drink a lot, get sleep, exercise. I I already did that. I mean, I am healthy. I
Yeah.
exercise, I eat healthy. Yeah, but I would definitely, and then talk to people. Talking about it with whomever you feel comfortable helps.
Okay. And what do you think in terms of the entire kind of like medical system, what do you think they do well in this system, in this situation? And what do you think they could do better?
I feel as though once I was diagnosed with it, it was up to me to make the appointments, know who to go to. Nobody really gave me any guidance, and I feel like they dropped the ball there. And I was lucky because I knew who to go to, but if I didn't, it would have been a lot more difficult. This was 5 years ago, so hopefully it's improved since then.
Yeah. Well, that's clearly the gap that you
Right, there
saw.
was a gap. Once after your biopsy and you're diagnosed, then it's like, oh, what do I do now?
So knowing that, what do you wish every patient that might be going through this right now knew about the medical system or their
Well,
doctor's situation?
I know where I had this done, they had people that were supposed to be your advocate and help you, but nobody I got in touch with me, so I got in touch with them, left a message, nobody called me back. So I was on my own, but like I said, I knew what to do as a registered nurse, being in the system. But for people that aren't, I could see where things could get messy.
Are there any specific questions or actions that people should take during that time?
Yeah, once you're diagnosed, okay, who do I see next? And if they say surgeons, can you give me a list of surgeons you recommend? And if they say oncologists, can you give me a list of oncologists? I would think the surgeon or the oncologist can give you radiologists if you need radiation, but you don't know that at that point until they do the surgery.
Mm-hmm. So then you get the surgery. Walk me through a little bit of what your experience was like with the surgery and then the treatment phase in general.
Surgery was pretty simple. It was an hour to 2 or 3 hour day surgery. Went home that day. You have to have someone with you, any surgery where you have anesthesia. It was general anesthesia. I never even took a pain pill. I just had to take it easy for a day or two and, not do any heavy exercising until I saw the surgeon it was about a week later.
Oh.
I had a little bit of a problem where I had something called seromas. So where they removed the tumor, as little as it would fill up with fluid, and I had to get the fluid drained a couple of times.
Gotcha.
That wasn't painful. It was just I had to keep on going back to the doctor's office once a week to get it drained. That was my only problem. But without that, you could get back to exercising within 2 to 3 weeks and back to your normal life.
Oh.
Yeah, easy.
Okay. So you have that surgery,
The
but then
lumpectomy, not
the
a
lumpectomy,
mastectomy.
correct.
Yes.
And you go through that, but then you get to the next level of treatment.
Right. So it's a couple weeks after surgery. For me, it was radiation.
Okay.
Every day for a month.
And what made you decide radiation?
If you don't get a mastectomy, you need radiation.
Okay.
At least I did.
Mm-hmm.
I was stage 1A. So, the radiation. I was nervous about radiation. The only side effect I had from radiation was I was tired after the first week. But you have to go every day. It takes less than a minute for them to do radiation. To set you up on the table is longer than the actual treatment. You don't feel anything. It's like getting an x-ray. But it's every day. For me, it was back then. Now I think they do it for a shorter period of time.
Gotcha. So if it's every day for how long did you do
For me, it was for a month, 30 days.
Every day for 30 days.
Yeah.
And during that time, the only kind of side effect you saw from radiation was
Fatigue. Some people get rashes and red, burned skin. I didn't get any of that.
Wow. Okay.
No pain.
And I mean, as
Just
far as
fatigue.
managing the fatigue, you just
I would take a nap
rested.
every day. Yeah, rest.
Yeah.
But you do have to take care of yourself and, rest and get lots of sleep and eat properly. And
Right. So you've got 30 days of treatment.
right.
You're going through radiation.
I walked 5 miles every day.
Really?
Yeah, I couldn't run. And they didn't want anything changing inside of the breast, but so I walked every day.
Wow.
Made me feel better.
Yeah,
Yeah.
that's amazing. So
Yeah.
finding
Mentally
something
healthy.
Yeah,
Yeah.
that was
For
my next
me,
question.
exercise keeps my brain healthy. So they said I was able to do it through radiation.
So is that if somebody's going through radiation, you've got 30 days of a daily reminder.
Right. Now
that you've
it
got
may be
something.
only a week or two. Like I said, radiation has changed in 5 years.
Right. Okay. Yeah.
So
yeah.
I don't know.
But you've at least got this reminder every so often that you're going through something.
You don't forget about it.
Right.
That whole time.
And how do you manage that mentally? You're
It's
working
hard.
through it,
working
and
through
you're
it.
in the
For
early
me,
stages.
exercise, talking to people, but it was a time where I laid low. Just a lot of. It's tough mentally. That you have to have this in order to make sure you're going to live.
Right. After radiation, was there anything else that you had to do to?
I have to take a pill every day.
Okay.
A hormone blocker. I did not need chemo. I was, again, one of the lucky ones. There's an onco score. They look at your tumor and they look at individually to see if you specifically have certain, characteristics where you may need chemo or not. And they give you a number. It's one going all the way up. And I believe anything under 20, you do not need chemo. And I was less than that.
Interesting.
But that might have changed also in 5 years.
Right.
But I know they still do that on typing.
Okay.
Mm-hmm.
So you got the radiation. Explain to me kind of the gap between you got the treatment and then to...
I just started the pill. I could have started the pill during radiation, but I waited till after.
Why was that?
I just thought I didn't want to do 2 new things. And if something made me sick, I wouldn't know which one it was.
Yeah, that makes a lot of
Because
sense.
radiation can make you feel
Right.
bad. I mean, it really didn't at all. And the pill, I had to go through a couple of different pills before I found one where I didn't feel nauseated.
So you went through radiation, then you started taking the pill. At what point did you kind of get the news that you're in recovery, or how long? What did that look like, that transition?
As soon as the surgery is over and you have the radiation, you're in recovery.
Wow.
You take this pill for 5 years, and that pill helps keep it away. A pretty large percentage. I'm 50-60%. So like you may not like taking a pill every day, but it feels good to take it because you feel like you're doing something.
Right.
You had surgery, you were doing something. You had radiation, you were doing something to get rid of it. Taking the pill, you're doing something not to let it come back.
Yeah.
I could stop taking the pill now at 5 years, or I could go on another 2.5 years. Gives me a little bit higher percentage of it staying away, not very much, but I decided to keep on taking it because I'm still doing something to keep it away. So mentally, I feel like I don't want to stop because that's scary to me, not doing anything.
Right. You feel like you're
Proactive.
involved in your recovery.
I'm proactive.
Yeah. And I mean, that recovery and remission monitoring phase, what does that look like? How do they check up on you?
You see the doctor you see the oncologist. Well, you see the oncologist before you even get surgery. You establish a relationship with an oncologist. You may want to see more than one to see who you like. Mm-hmm. This is right after, you see the surgeon, you set up your surgery. You could set up appointments with an oncologist at that point.
Right.
And then you see this oncologist right after your surgery, and then again every 3 months for a few years. And then you go to every 6 months. And that's where I'm at now.
And how do you manage that mentally? Like, you look at going through that phase of transitioning into active treatment to recovery. What does that process look like mentally?
You feel good that you're done with treatment. But anytime you feel a pain anywhere or something's different, you worry, oh, does this mean cancer's back? Am I okay? But they watch you closely every 3 months. They do lab work. You get mammograms frequently the first year or two. Can't remember how often. Now 5 years out, just once a year mammogram. I'm like everybody else.
Wow. That's got to feel good. And I mean, during that process, did you feel in control? Did you feel...
You get to the point where I don't know if you're ever totally in control, but you feel like I don't have cancer. You feel good.
And how did you stay vigilant in kind of being prepared mentally for any sort of remission? And how do you right now in that process? But also try and live life to the fullest and understand that you're in recovery, you're in remission.
I think it makes you think differently about things. I don't think about cancer coming back. Maybe that's not, I can't think about that. I put that aside somewhere else. But if any little thing happens, it's a reminder that it could come back. But percentage-wise, I'm in a good spot that it won't come back, but that doesn't mean it won't.
Right. So that percentage kind of keeps
me optimistic.
At level, yeah.
And you could only do what you could do. Otherwise, it's out of your control. I think a lot of this teaches you you're not in control of everything. You're just not in life.
Yeah.
That goes with a lot of other things too, but
Right.
you're not. One thing that really helped me, I did not go to a support group, but a close friend of mine got diagnosed with cancer 3 months after I did. Now, it didn't help me. I was sad. I was devastated that she did, but we've walked through this journey together. She came with me when I first got into a lot of my doctor's appointments, my radiation. She would come, hey, let me just go with you. I'll take the ride. She was a big help. So when she got it, she said, you help me because I know what to expect.
Yeah.
And she had the same the same treatment as I did.
Really?
So yeah, we've been through. So she, even though I'm married and I have children, she's the first person I call if I feel like something might be wrong, and vice versa. She calls me immediately too.
That's amazing.
And we'll talk to each other if we're not together as we're driving to an appointment, if we have to have a scan, which you do have lots of scans, and they're very nerve-wracking, waiting for the results. But we talk to each other a lot when those things happen. And so it's important to have somebody that you can talk to and somebody also that understands what you're going through.
So you would suggest, in terms of, I know you didn't reach out to any support groups.
I did reach out.
You did?
I did at the beginning. I just never wound up continuing with it because my friend was there all of a sudden, and there was no better support system than each other. We were best friends before it happened. So,
gotcha. So somebody that didn't have that friend, you would...
A support group or reach out, try and find some people that have been through this.
Was there any part of your kind of recovery and remission phase and any aspects of the follow-up care that you felt like were confusing, didn't make sense, or you had questions about?
No, everybody was really good about instructions and telling you what to expect, everything that you're going to go through.
That's interesting. Yeah. So looking at it, you almost get more interactive support during the recovery phase than you did in the very beginning?
Yes, definitely.
Wow.
Definitely. Radiologist was great. Surgeon was great.
Oncologist
was great.
Doesn't that seem a little backwards?
It does. Yeah, it does. It was at the beginning that was a little confusing. And as I said, I have knowledge about it. So I would think it would be really hard for somebody that knows nothing.
So having seen kind of both sides of the coin and flipping that on its head a little bit and being a patient, Now looking at kind of like the side of being the medical professional, what should people know if they're a medical professional about the emotional journey somebody going through breast cancer is going through?
It's one of the biggest journeys they're going to take, and it's a scary journey. But most people wind up okay.
Yeah.
And I think people don't know that.
Yeah. That's important. The
Yeah.
optimism, I feel like you've talked
optimism,
about
I
that
think,
so
is,
much
yeah,
today, is finding the positive.
finding the positive. Yeah,
Yeah.
definitely.
How can family members help?
Just be there to listen. Just listen. Yeah, listen to them and don't minimize what they're going through. But in the same breath, I wouldn't make this person feel like they're a chronically ill person, even though they might be for a little bit. It's going to get better.
Mm-hmm. So to close things out, and I appreciate you
Okay.
coming on today. I know this is very difficult to talk about,
Yeah,
but
no, it's okay.
to close things out, if you could go back and visit yourself, the day of the diagnosis, the moment of the news, you walk out and you meet yourself, what would you say to yourself?
You're going to be okay. It's going to be easier than you think. Physically. And mentally, it's going to be tough, but you're strong and you could do this. And you're going to be okay.
That's beautiful.
Yeah.
That's beautiful. Shelly, thank you for sharing
Oh,
your story today. I know
you're
a
welcome.
lot of people out there will appreciate what you've shared today.
I
know
hope
it's not
that
easy,
to help somebody. Yeah.
but thank you so much for
But get
coming
your
on.
mammograms. Most important. Don't skip a mammogram for anybody.
Yeah, I love that. Thank you.
Okay.